So the topic that has been given to me is why do we need ethics guidelines in medical research? Uh, I think some of these slides, Vinita would have already talked to you about this, so maybe I'll try and spend less time on this. So ethics is a discipline concerned with what is morally good, what is morally bad, what is right, what is wrong. And these set of values are very individual, and they could vary from person to person, and a person establishes for oneself. So this word comes from a Greek word called ethos, which stands for character or the guiding beliefs, values, or ideals that characterize a group, a community, a nation, people who, a cohort, that so to say. And when what we are talking about today is research ethics or ethics related to research. So basically, it means moral issues that arise during or as a result of our research activities, which means it includes the conduct of individual researchers such as you and me, and the implications that it has for the entire research community, such as the institution SGPTI. So, there is something called law and there is something called ethics, and there is a minute difference between the two. A law is a systematic body of rules that governs the entire society and the action of individual members. Ethics, on the other hand, are something softer, something not as well laid down. Laws are laid down in a book. Ethics are a branch of moral philosophy that guides people about their basic human conduct. To that extent, even though we may say that ethics are not necessarily hard and rigid, but because they are about basic human conduct, it is thought that most people would nevertheless follow them. So, law is something that is set by the government. It is a set of rules and regulations. It is usually in writing. Whereas ethics is a set of guidelines, norms, which are laid down by an individual. My ethical standard can be very different from another person's. And to some extent, they are laid down by legal and professional norms. A profession decides what they think they want to do, but it is not laid down by a legislature. And they're often abstract, like don't tell a lie, be good to people, and so on. Laws have a binding status, ethics are not as binding on a person, and violation of law is not permissible. And generally, the law will lay down that if you break it, what would be the punishment? It could be imprisonment, it could be fine, or both. Ethics generally have no punishment for violation of ethics, though sometimes the distinction between law and ethics may not be as clear. So, if we look at ethical principles for doctors, for our profession, the earliest mention seems to exist in something called as the Oath of Hippocrates. And basically, what it says is a physician should do no harm, especially to a patient. Now, that's the European concept. But if we look at our own culture, our own society, Charak Samhita, which was published somewhere between 2nd century BC to 2nd century AD, also lays down four ethical principles for a doctor: friendship, sympathy towards the sick, interest in cases according to one's capabilities, and no attachment with the patient after his or her recovery. If we go to the Middle East, the Mediterranean region, there is this book called Adab al Tabib, which can be translated from Arabic to English as Morals of the Physician, which was written by Al Ruhawi, a 9th century physician who was a Christian to begin with, but studied Islamic law, and this is mainly uh, based on Islamic principles. It has 20 chapters organized in three general categories: the conduct of a physician, the conduct of the patient, and conduct of the public at large towards the medical profession and their patient. So basically, all cultures, all societies have had some principle for doctors to follow because doctors are believed to be different. If we now look at research, biomedical research has also existed much before we think. We think that it came with modern medicine. No. Initial research was mostly observational, but with time there has been an increase in interventional studies. And even if we look at interventional studies, you'll be surprised to hear, at least some of you, that the first interventional study, the first clinical trial, was done somewhere in the 18th century by a person called James Lind. He is credited with having done the first clinical trial. So this is what exists in his book on scurvy, which he published in 1753. But this was done in 1747. On the 20th of May, 1747, I took 12 patients in the scurvy, meaning 12 patients with scurvy, on board the Salisbury at sea. So that was a ship that he was commanding. Their cases were as similar as I could have them. That looks like inclusion criteria and making that disease is similar. They all in general had putrid gums, spots, which means pitiki, and lassitude with weakness of their knees. They lay together in one place, being a proper apartment of the sick in the forehold, in the front part of the ship, and had one diet common to all: water, gruel sweetened with sugar in the morning, fresh mutton broth, oftentimes for dinner, at other times puddings, boiled biscuits, and sugar, with supper, barley, raisins, and so on. In addition, two of them got a quart of cider daily, two of them got sulfuric acid, two received 6 spoonfuls of vinegar, some received two received seawater, two received oranges and lemon, and two received a spicy paste plus a drink of barley water. So that's like like a controlled trial with 6 groups. Treatment of group 5 stopped after 6 days because they ran out of oranges and lemon. But by that time, one sailor was fit for duty and the other had almost recovered. Apart from that, only group 1 that received apple cider showed some effect. Would we think that this is a valid clinical trial today? I don't think so. We will say it had a very small sample size, only 2 subjects, 2 participants in each group. There were too many treatment groups, so there will be multiple comparisons. The allocation was non-random. He did not draw random numbers. He did not take ethics committee permission, something that Dr. Vinita would have talked to you about. He did not take consent from the subjects. All the subjects were his subordinates, he being the captain of the ship, and all this would not be acceptable. And in another time when I took this lecture, somebody said the trial was not registered, which you will hear about in the next few days. Let's move forwards in time. And you would have heard about Edward Jenner. This was something done in late 18th century. He noticed that the people who looked after, the maids who looked after cows developed something called cowpox and then developed smallpox. Smallpox was a big killer at that time. He thought that cowpox somehow protects people against the smallpox. So he took this person, a milkmaid. Her name was Sarah, and she was infected with cowpox. He took the fluid from the blisters of cowpox that she had and inoculated these into a servant's child who was named James Phipps. And after he had a mild cowpox for a few days, thereafter he got hold of smallpox scabs from a smallpox patient and took material from that and inoculated this boy whom he had earlier given the cowpox virus. And he found that there was no illness in him, and that is how we got a smallpox vaccinia vaccine. So he thereafter did this on 23 persons, mostly children, including his own 11-month-old son. And today, this will not be possible because At that time, the ethics were different. Ethics have changed over time, and beliefs and values of people change, relationships and expectations of individual in different relationships change, and this leads to change in ethics principles. So ethics principles have evolved. So let's look further how things, the research and research ethics have changed over time. This is now we are moving on to the 19th century, a PhD thesis, University of Edinburgh, and the investigator was a gentleman called Alexander Hamilton. He was working with the Scotland Navy. At that time, it was thought that for many diseases, bloodletting, which means removing blood from a person, was a good treatment. So, however, he believed that this was not necessarily true, that this was just something that was being followed. So, he undertook a trial, and that is what he writes. It had been so arranged that this number was admitted alternately in such a manner that each of us had one third of the whole. So, these were three clinicians treating people, and each received one third of patients. The sick were indiscriminately received and were attended as nearly as possible with the same care. So there was a principle of control group. There was a principle of similar numbers. There was a principle of other things remaining the same and accommodated with the same comforts. One third of whole were the soldiers of 61st Regiment and rest of the 42nd Regiment. Neither Mr. Anderson nor I ever employed the lancet. Lancet was something that was used to remove blood. So, two groups, there was no bloodletting. He lost two patients. Two of his patients died. Four of my patients died. Whereas in the third group, which had been treated with bloodletting by the third surgeon, 35 died, showing that bloodletting, let alone being useful, was actually harmful. If we go to late 19th century, we have further studies. At that time, it was thought that belladonna was something that would prevent scarlet fever from happening. And this is a study where they showed that did not make any difference. Another one in the early 20th century, after I had treated some adult diphtheria patients with ordinary horse serum in 1911, I began in 1912 to treat alternate adult patients with antitoxin serum and with ordinary serum exactly in the temporal sequence in which they were admitted to the ward. The children all received antitoxin serum, and then he went on to show that it works. And then he says, I note that it is absolutely inadmissible to compare the results of different time periods. That if you give during 1 year the antitoxin serum and then in the other year the ordinary horse serum, then you would come to totally different conclusions. So science was evolving, studies were evolving, people were doing different things and trying to show what treatment works and what does not. And therein comes the first time ethics started to become a problem. So there was this Italian doctor, Dr. Sennarelli. He was a bacteriologist. He, in late 19th century, organized an organism, a bacterium, and he thought that this was the cause of yellow fever. You all know that yellow fever is caused by virus. So he was surely wrong, but at that time it was thought that that was the cause. To prove that, in 1897, he injected his yellow fever isolate, a bacterium, into 5 people without any consent. 3 of them became sick and died. This triggered the first major public debate on medical ethics, and he was extensively criticized, and it was thought that he had done something wrong. Remember, this was no different from what Jenner had done and many others had done, but standards had changed, people's thinking had changed, and so this was thought to be a wrong thing to do. Let's move another few years ahead. So, or around the same time, in the late second half of 19th century, Walter Reed, you would have heard about Walter Reed Institute, which is a major US research center for the US Army. He was, that's named after him. He was a US Army physician. In 1901, he led the team which confirmed a theory that had come up from a Cuban doctor that yellow fever is transmitted by a particular mosquito species. Till that time, it was thought that yellow fever was spread by contact between a person with the disease and a person who did not have disease. And this Cuban doctor thought that there was need for a mosquito, that a mosquito bites a person with yellow fever, and then when it bites a healthy person, the disease is transmitted. So Walter Reed is the first person to have proved the concept of vector-borne transmission. So he was an important scientist. So he showed to do this, he undertook studies, and in this, he wanted people to sign a document. This document is the first time we can see the evidence of medical consent. And he promised them, if you see these red boxes, US dollar 100 for participating in the studies. Think US dollar 100, and we are talking about some 125 years ago. So that was a huge sum of money. And he said, people who agree to be bitten by a mosquito that has previously bitten people with yellow fever, then he would give them this money. So this was informed consent. Let's move forward to 1950s when the SARS polio vaccine was made. So people by now knew that we need to do studies, we need to show that something works. So paralytic polio was a disease of relatively low incidence. So that means if you were to do a large trial, it would have to be very large. There would be school age children who have the highest case rate, and they thought that they would do this in children who are studying in grade 1 to grade 3 in 272 counties like our districts where the disease was higher. But at that time, it was thought that if you were to tell people that they will either get a new vaccine or they will get a placebo, it would be too much of a calculated risk, and people may not like this study. And they thought that such a study where people get either a vaccine or a placebo would be a beautiful experiment where a scientist would be extremely happy, but people will not accept this. So they actually did this, that they went around and they did a study where they asked people whether they would like to take the vaccine. So it was not a randomized study. So there were problems. It was thought that if you ask people to get randomized, people may not accept it. People may find it a concept very alien to them. However, the biggest problem with ethics came during the Second World War. We all know about Nazis. They did a lot of experiments, and I'll talk about some of those, and they were thought to be a problem. They took prisoners. Many of them were those belonging to enemy countries. There were Jews, and there were people who they thought were against it. They took these people, they wanted to study what happens at high altitude and how you can prevent high altitude sickness, etc. So they took prisoners and they put them into low pressure tanks from where a part of the air had been sucked out, to see how long these people could survive with limited oxygen. Some of them died. To see how the changes in their bodies compare with those who have not been kept at low oxygen pressure, they put some of them underwater until they died, and they did autopsies in those who died in a tank with limited oxygen and those who died without being exposed to low oxygen. Similarly, they did freezing experiments. They took prisoners, they forced them to remain outdoors in European winter without any clothing, or to stand in a bath of freezing water for 3 hours at a time. Then, after that, they would rewarm them. Some died, many died rather, and then they would try to rewarm them about to study how people who had been exposed to cold could be rewarmed and revived, but often that did not work. They did experiments with malaria. They infected them with malaria and gave them a variety of drugs, which were at that time thought could have activity against malaria. Some died of malaria, and many died from the toxic effects of these experimental drugs. In the war at that time, mustard gas was used. They wanted to understand how could they treat their own soldiers who were exposed to mustard gas. So they did studies on these prisoners by forcing them to inhale mustard gas or creating wounds on them and exposing those wounds to mustard gas and then trying various treatments. Similarly, they tried sulfas on the wounds that had been created on them. They wanted to get a vaccine against typhus, so they injected them with the anti-typhus vaccine and then with typhus. Controls were those who received no vaccine but only typhus organism. So they also, so as to maintain typhus, so for doing these studies, some people were just infected with typhus so that they acted like a live culture of the typhus virus. Also, there were studies on poisons. There were studies on effect of bombs. They thought that they needed to sterilize these people who they considered they did not want to reproduce so that they could be exterminated. Because surgical sterilization was time consuming, they exposed them to chemical sterilization or X-ray sterilization experiments. They did studies on twins. They wanted to show that heredity was important in determining phenotypes. And so one person, Joseph Mengele, had collected 1,500 sets of imprisoned twins. These were from among people who were brought to Auschwitz to kill them. So twins used to be separated and they were used by him. He would do different experiments with them. One twin will be experimental, the other will be control. They also try to join twins by stitching them together to make conjoined twins, causing gangrene and ultimately death. I know many of you can't even imagine that these things were done, but yes, these were done. It was human beings who did these experiments. When the World War II ended, all this came to light. At that time, a US court laid down, they laid down after the Nuremberg trials something called as the Nuremberg Code. These were a set of principles that were put together so that they will regulate human experimentation, medical experimentation. Some believe that these principles are actually not created by a US court. Though the US court may have put this forward, these were actually a small group of German physicians who were very upset with what was happening during Nazi uh, regime, and it was they who had put forward these and said that this is what should be followed. However, the rulers at that time did not find this convenient, and hence these were not put into action. These are a set of 10 principles. These are: voluntary consent of the subject is absolutely essential. The experiment should be such that it should be expected to yield results for the good of society and to obtain results which cannot be obtained by other means. The experiment should be so designed based either on prior knowledge of the subject or on animal experiments that the anticipated results justify the experiment. The study should avoid unnecessary physical and mental suffering and injury. No study should be conducted if there is a reason to believe that death or disability will result. The degree of risk should never exceed the importance of the problem to be solved. The investigator must make adequate preparations or take precautions so as to make sure that the subjects are protected against injury, disability, or death to the maximum possible. The experiment should be conducted only by scientifically qualified people and a person who's most who's well aware of the particular subject. The subject or the participant should be at liberty to end his participation at any time. And it's the duty of the researcher to stop the study at any stage if he or she feels that there is likelihood of injury, disability, or death if the study is continued. It's not that there has not been unethical research in other parts of the world. Nazis did some extreme things. However, it is well known that history is written by those who are victorious, and there is some evidence to show that similar studies during the same era were done in other parts of the world, including in the United States of America and other developed countries, the allies, during the same period. Now, let's move further forward and look at things that have been done in other situations. An important landmark in the history of medical ethics is the Tuskegee syphilis study. This study started in 1932 and it was started by the United States Public Health Service and the Center for Disease Control, or the CDC. It was done in collaboration with Tuskegee University in Alabama. Alabama is a state in the southern part of US where there is a large proportion of the population is Black or African American. So this is a reputed university where there were a lot of Black patients and also Black employees. They enrolled 600 men of African American ancestry, Black men, who at that time had very little political power or very little importance. And these were people who were working on other people's farms, and whatever they would grow, they would get a share of it. Of these, nearly 400 had latent syphilis. The remaining 200 were enrolled as controls, and they were supposed to remain in the study for 6 months. The idea was to study the natural history of latent syphilis. They were told that if they enroll in the study, they would get free medical care. The idea was to find out whether the natural history of disease is different in blacks than in whites. Natural history in whites was well known. They were not even informed that they had syphilis. They were just told that they had bad blood and they would be observed and given treatment. But once 6 months were over, they were supposed to get some treatment. At that time, the treatments available were weak, and then they were supposed to be followed up. Ideally, the follow-up should have stopped at the end of 6 to 12 months, but they decided to continue following them up. The turning point came in 1947. At that time, penicillin became widely available and became the standard of care for patients with syphilis. However, somebody decided that we have a very beautiful cohort of people being followed up for natural history of latent syphilis, and that we should continue to observe them to get this information. So it was decided not to offer them treatment, and they were followed up without any treatment till 1972, 25 years after the discovery, after the availability of penicillin. It is at that time that this came to light, and there was a huge fracas and a lot of heads rolled. But the fact remains that even today, because of this, a lot of black people in the US still don't have faith on doctors and the medical system. Another interesting area study was the Willowbrook study, which comes from my area, viral hepatitis. Willowbrook State School was a state supported institution for children with intellectual disabilities located on the Staten Island in the New York City. These studies were done during the period from 1947 to 1987. So they used to admit children who had Down syndrome and other intellectual disabilities. And it was found that outbreaks of hepatitis were very common among these children. These children were not toilet trained, so if there was one person who had hepatitis, they excreted the virus in the stool, and they not being toilet trained, they would pass on infection to others. Similarly, there was it's well known that in Down syndrome people, hepatitis B transmission from one to another is very common. So they started off thinking, how can we prevent this hepatitis outbreaks? And they decided to do medical studies during starting from late 1950s. And these were done in collaboration with famous scientists, Saul Krugman, Robert McCallum. Some of these people have gone on to win Nobel Prizes. The idea was to, and these studies have been very helpful. What we know about viral hepatitis today, a lot of it came from these studies. These studies help understand that hepatitis is of two types, that spread by blood, what was initially believed to be hepatitis B, but now also includes hepatitis C, or infectious hepatitis, which is spread by fecal oral route or close contact, at that time called hepatitis A, but we now know that there is also a hepatitis C. They also showed that one episode of hepatitis of each type prevents future illness of the same time on of the same type of hepatitis on re-exposure. So there is immunity. Also, these studies showed that if you developed a gamma globulin that can prevent hepatitis of either type. Now, they suspected very early on that it was the stool which was the cause for transmission. So, one of the studies involved feeding new inmates who were entering with live hepatitis virus from stools of those who had had viral hepatitis. The investigators thought that this was justified because with such a high rate of attack after these children entered this institution, virtually everybody anyway developed hepatitis. And what they was doing was they were trying to get some information, and that if they could establish this and they could find that uh, people develop antibodies or something like this, then they could use that those to protect or to develop a vaccine. Then they would be actually helping in the long run. They would anyway get hepatitis, so why not we give it to them and that would be better. And then they thought that the parents had given consent for these studies. Yes, they did take consent from the parents, but the problem was possibly parents had no choice. Those were the times immediately after the war of depression. In the US, it was difficult for the families to make ends meet if both the parents were not working. And if you had a child with Down syndrome or mentally subnormal child, the mother could not work and the whole family suffered. So parents were interested, they would give consent for anything if their child could be admitted to the institution, and that's possibly what forced them to do that. So there was some undue pressure. We now know that some children actually went on to develop chronic hepatitis B. At that time, these investigators had no idea that there is something called chronic infection. In 1970s, the facts came to light, and then these research studies were stopped, and this Willowbrook institution was closed. However, subsequently, it has also been found that similar studies were also done in mentally normal adults who refused to be enrolled in the army because there was a compulsory draft. So if you did not, if you said, I don't want to enroll in the army, you were kept in certain other uh, houses and such studies were done again with consent. But the main thing was that you could avoid military draft by participating in such studies. So let's move to the field of oncology. There is this scientist, Dr. Southamp. He was an immunologist and oncologist at the famous Memorial Sloan Kettering Cancer Center and Cornell University Medical College. He injected live cancer cells taken from patients with cancer into human subjects without disclosing that what he was injecting was cancer cells. He used people who were not in a position to give consent or had to give consent, such as people who were supposed to be in prison or very elderly people who were in long term care and they were senile. His thought was that because these cancer cells come from another person whose HLA was different, the body of the recipients would anyway reject these cells very soon and they would not develop cancer. When this became common knowledge, it appeared in the New York Times in 1956. There was furor, people condemned him. He went on further to test West Nile virus as a potential cancer therapy. His thought was that if you inject a virus, that will lead to mounting of immune response against the virus. That would accentuate the immune response in general, and that could also might help to take care of the cancer cells. So in 1950s, he injected this virus into over 100 patients with terminal cancers of various organs. He reported good results in some patients, but some others had severe West Nile fever and died of the infection. He was highly respected. He was, after all these studies, elected president of the American Association for Cancer Research and headed a large division of medical oncology at a prominent hospital till the end of his career. Similar things have been done in other countries. And now let me talk to you about something which may appear less mundane, more mundane, but very interesting study. We may not think of these as unethical, but when we look at finally what happened, when it went started, it did not appear very unethical. In 1940s, dental cavities were common. People suspected that there is some relationship with intake of sugar, but there was no proof. So these studies were done in Vipholm, which is in Sweden. It is Sweden's largest facility for what at that time was called uneducable retards, meaning mentally retarded children. Beginning in 1947, a group of inmates at this center were given large amount of sweets to eat. This included some toffees which were specially formulated so that they will stick more to the teeth to find out whether sweets had anything to do with dental cavities. Of the 660 subjects, 50 developed deterioration of teeth after they were given sweets. So, to the investigators, it was a successful experiment. They were able to prove that eating sweets leads to dental caries, dental cavities. 2 years later, they changed the diet of these people and to a more normal carbohydrate rich diet, and they found this led to a reduction in the dental occurrence of dental cavities, proving the opposite, the same thing by another method. And this led to a recommendation in Sweden that children should eat sweets very infrequently. And Sweden has a virtual kind of law that children are allowed to eat sweets only once a week rather than during the entire week, even today. And it's a very interesting phenomenon. If you go and read on the internet, most Swedish parents take their children to sweet shops on Saturdays and they buy sweets. They can eat that on Saturday, but not on other 6 days of the week. So when this study was done, the confectionery industry donated huge sums of money and tons of chocolates and caramels for this experiments. They were interested in this because they thought the studies will prove that sweets don't cause dental cavities. However, the study showed a clear link. The industry was not pleased with the results and they worked with the investigators to delay the publication of research findings. So when the findings were finally published in 1953, remember the study was done in 1947, there was a debate about why the results had not been published for 4 to 5 years. But at that time, no questions were raised about the ethics of the study. The dentist thought the study was justified, and the ethics questions were raised only as late as 1990s. So, what is the problem in these studies? The problem is we are all supposed to be physicians. When we try to do research, there is a conflict between our role as a physician, what has been taught to us physicians as physicians, and the role of a researcher. As physicians, our primary interest is to do what we believe is in the best interest of our patients. But as researcher, my duty is to see what is in the best interest of one's study. That is, I should be able to get a valid answer to my study question, and I should be able to get that answer quickly and in a robust manner. These two interests may not always be well aligned. So, what the principles of ethics do is there are various bodies, they have tried to lay down some principles so that medical research, and remember, doing medical research is actually helpful to the society at large. So, doing so is in the best interest of the society at large so that we can do medical research while ensuring that we do not interfere much, and that word much is important, with the principles of providing good medical care as per the principles that apply to a physician to our study subjects. So it's possible that Vinita has already talked to you. So what was done was a declaration of Helsinki. It's a set of ethical principles regarding how human experimentation should be done. It was developed first in 1964 by the World Medical Association, and this was kind of, it took some principles from the Nuremberg Code, and it has undergone 7 revisions. The most recent was in 2013, unless there has been one in the last few months. I prepared these slides about 6 months ago, and there have been 2 clarifications. The original version had 11 paragraphs. The current version has 37 paragraphs. It's not something that is legally binding, but it is thought. It is considered to be morally binding on all physicians around the world, irrespective of their nationality, irrespective of origin, irrespective of their gender. Declaration of Helsinki is considered as an important step in the history of research ethics. It was the first effort made by the medical community, the medical uh, group at self-regulation of research. There have been many other documents, some country specific, some general, but really speaking, they are all using the principles of Declaration of Helsinki. Another important document, again, Dr. Vinita may have talked to you, is the Belmont Report. This was created in the US by a government agency. So this was National Commission for the Protection of Human Subjects of Research. These were issued in 1978-79, about 15 years after we had the Declaration of Helsinki. And this was done because they, I told you earlier that in 1972 they came to know that there had been problems in the Tuskegee syphilis study. So this commission was set up in response to that, and they are the ones who provided this Belmont report. It summarizes ethical principles and guidelines for research on humans. There are 3 core principles, and again, they might have been talked to you: autonomy, beneficence, and justice. Some people divide beneficence into beneficence and non-maleficence, and it is thought that there are 3 major things you need to do to ensure these 3 principles: informed consent, which ensures that there is autonomy, there is assessment of risks and benefits and selection of subjects. These ensure that there is beneficence, there is non-maleficence, and also the selection of subjects can ensure to some extent justice. In our country, we have the ethics guidelines. They were first brought up by ICMR in 1980 as a policy statement on ethical considerations, but there have been further updates. 2000, they were updated from policy statement, it became guidelines, and these have been revised in 2006 and 2017. And these are available, and you'll be hearing more about them. With that, I think I've given you the context, the historical context of what all has happened, how biomedical research evolved, how ethical problems evolved, and how response to those has evolved. and therefore why we need ethics guidelines and why do we have what we have today. Thank you for your patient listening. If there are any questions, I'll be willing to take them up. Thank you.